Hello, everybody. Today, we're going to talk about headache, what they are, how to make them go away, and we're also going to talk about New Year's resolutions. Is it something that's important? Is it something we should be doing? Is it something that's even helpful or even useful? And I'm here today with,
Jen Beck.
say good morning, tell us a little bit about yourself.
Sure. Good morning. My name is Jen Beck. I'm a registered nutrition consultant and a certified lift practitioner. I own Complete Health Revolution, and we help you to reclaim your health and recharge your life by figuring out what you need to be eating and also what's eating you so that you can create lasting habits and lasting change. And we're
Excellent.
also here in Cincinnati.
And you see people with headaches,
I do.
and we all have some success in helping people make them go away. What do you find is most important from the pieces that you add to the puzzle?
For me, it's always about starting at the fundamentals and starting people with small, basic changes. And one of the most important things that I see beneficial for many people, especially with headaches, is water. It's the simplest thing, and it's so simple to do, and yet it's so simple to forget about too. But just hydration is massively beneficial for
I
helping
have a
people to
very
diminish headaches.
knowledgeable friend who says you should be sitting all day long with a thing of water next to you. Every time you see it and look at it, you should be taking a sip. And every time you empty it, you should refill it and repeat the process all day long.
I would completely agree.
So
Hence
many
my 32-ounce glass.
people not only not drink the water, they drink so many things that are counterproductive to
Right.
the possibility of health. Um, soda is not something we should be drinking. Fruit juice is not something to be drinking.
No.
All right, well, we'll get back to that. Let's talk about headaches, where else they come from. Headaches don't come from your head. That's probably the first thing people really need to learn. We go to the neurologist, we go to the head doctor, we go to the spine doctor. They tell us all kinds of things, but the headache generally does not come from your head. We were taught as doctors it comes from the blood vessels in your head and in your neck, maybe because you can feel it pounding. That's really not true either. What you're going to find is that pain in your body comes from the places that are tender. So, where are the things that are tender that cause headache? Jen, you know some of these, right? In your neck and shoulders and upper back.
Yeah.
So, here's one way to find them. There's a muscle right here along the front and side of your neck. It's a really big, kind of thick muscle. Take that and you can grab hold of this muscle. You can pinch it between your index finger and your thumb, and you can feel that within this muscle, there's ropey, tight bands and
Mhm.
ropey, tight cords in this muscle. Well, the places where these are tight and the places where these are most tender, that can generate headache. And the diagrams have been around for a long time, and that's this one right here in the front center of your screen. And these X's represent the ropey, tight bands, cords, where the nerves in that muscle are really being pinched by the muscle. And then those red speckles that send the pain up this way are where the pain goes. And if you take this muscle and you maintain pressure on it, and you continue to hold pressure on it, you'll actually feel that pain pattern if this muscle is sensitive or not. Well, where does the injury come from that causes this? Now push in a different place on your body. Go ahead and push right on the top of your collarbone, not on the front, but push in and then push down against the top, right here toward the middle. And you're going to find there's little lumpy areas, difference in texture that isn't quite smooth, and they're surprisingly tender. And these are the injuries that cause this to happen in your muscle. And just like this muscle causes this headache pain pattern, you'll also find there's other muscles in your neck, your upper shoulders, and these are the areas that contribute to the orchestra of injuries in your body that contribute to the pain you identify as a headache. If you can make all these kinks or knots in your fascia cords and strings smooth out and go away, and if you need to make these injured areas from way back in your childhood heal and help them get better, that's how you make the headache go away. But what glues this together is what we need to talk about in resolutions, right? Or what we need to talk about in how to change our body and how we think about it. Because what glues this together and what lights up this injury from many injuries in your lifetime, lights this up kind of like plugging it into a socket. That's the food that you eat that you don't even know is causing you pain. So we're going to talk a little bit about that, and then we're going to talk about how do we make those changes, and our New Year's resolutions, even should they be in the game? Are they important? Do they work? So let's talk first about which foods cause most of the pain and especially headaches. What do you find, Jen?
So through working with clients, I would say that dairy, gluten, sugar, for some people, grains, for some people, eggs and soy are some of the major ones.
I will totally agree with that. And so I find that these muscles in your upper shoulders, they can be tight and they don't have to be tender. If these muscles are tight and tender and you have not yet taken dairy, gluten, and sugar and artificial sweeteners out of your diet, you're really missing out. And you're not even knowing how much of that can be causing this pain. And don't you owe it to yourself the curiosity to find out if taking these out of your diet really makes a difference? And most often you have to take out the trifecta. You can't just,
Mm-hmm.
you can start with just one, and usually the one you start with is the one that's least painful, because the ones that are more painful are the ones you think you're bound to and you want to use all the time. Um, but really, if you take one out and you're not better, don't say that didn't work. You still need to take the other ones out.
Yeah, I think that's a big point, Hal, because I think there's a lot of people that go gluten free or they go dairy free, and they're like, well, that didn't do any good, without realizing that it's the combination of factors. I mean, some people occasionally, like I have people that they can eat bread and then they can eat cheese, but if they put it together, it's disastrous. Not understanding that there's inflammation caused by each one all the time. It's just amplified when you have multiple things in your body at the same time.
And it's not like one and one makes two. It's like one and one makes six.
Yeah.
And then there's the other issue right along parallel with that of people going, well, I'm mostly gluten free. I only have a little bit of cheese. Maybe I only put a little bit of butter with my. What do you say to that?
Well, so you can have a little bit of arsenic too. Do you want that?
Very good point. You can have just a little bit of pregnancy. You're still pregnant,
Right.
right? You don't get
Yeah.
just a little bit. So, and I talk to people about how this is an effect on your immune system, right? This isn't just
Mm-hmm.
talking to your headache. And what if your immune system was sensitive to the sting of a bee, right? There's people pretty allergic to bee stings. How many
Mm-hmm.
bees does it take to kill you?
One.
Yeah, or even less than that. What if the bee only partly gets you?
Mm-hmm.
It's like half a bee, you're still done for. Or what if you're the person on the airplane and somebody opens a bag of peanuts? They now tell you when you get on the airplane, sorry, there's somebody on here today with a peanut allergy. There's be no peanuts and don't open any on your own. I mean, they're
Yeah.
pretty vocal about that. So to think that you can get away with a little bit of butter when you're sensitive to dairy, um, often doesn't work. But how can you tell? What is the timing? You know, listening to us in this format is wonderful. But if we can teach you as the person how to listen to your body to know what it's telling you. And so what are the signals? How do you teach how to listen to your body?
Well, so for me, when I work with somebody, I actually have them monitor how they're feeling 30 minutes to an hour and a half after they eat. And we're looking at things like pain, digestion, energy, mood, headaches, really anything that is different. And because when you can start creating that correlation to I just ate something and now I feel off, that's a big factor and it's a big awareness. But I always remind people that it can be up to 3 days before you actually see a full reaction from a food you've consumed.
Great point. You're really lucky if you can tell in 2 or 3 hours. You're really lucky if your body is that fine tuned that you can know. But a lot of people they don't know till 6, 12 hours later. So what I talk about is if you wake up in the morning with pain you didn't have last night when you went to bed, and you don't remember falling out of bed or getting hurt during the night, it was something you ate last night that set off your immune system and lit you up.
Can you hold it closer, Hal?
If you go to bed in pain,
There you go.
you didn't have this morning, then it was breakfast or lunch. And that's the way we talk about it. And those are probably the earliest signs, but you're absolutely right. Can be 36 hours. Can be you created the injury by doing some physical activity that strained some muscles. And then you ate something the next day while this injury was still healing. It will light that up. We should be able to repair our small injuries under our radar without our body even telling us. You should be able to go out and do physical activity you're not used to, if it's not over the top, and not be sore the next day like you expected. The reason you're sore is because your body's showing you the injuries you had yesterday that it cannot repair under your radar because of the information from your food that Yuri mentioned in this talk. So let's go to resolutions. You don't like them. Can you talk about that?
Well, I think they set us up for failure. We as Americans have been molded with the diet industry to do all or nothing. And so people go, all right, this is it. This is year I'm going to get healthy. I'm going to go to the gym. I'm not going to eat any more sugar. Carbs are gone. I'm going to have a dry January. I'm not going to drink anymore. Like I'm all in. I'm going to do it. And your brain goes kicking and screaming into activity for a day or two, or maybe a couple of weeks. But its whole goal is to be able to drive you back or drag you back into the comfort zone. So creating a massive overhaul of your lifestyle like that isn't sustainable because it's too much too soon. Not to mention somebody who hasn't worked out in a year or two or even 3 months is going to go to the gym and get sore. And our brain goes, we don't want to be sore. Mm-mm.
That's right. I didn't like getting up early. I don't like this whole drill. I think I'll do this for a week.
Yeah.
And
It's like,
you
why
might
bother?
last
And
a week.
right. Well, and they say that what is it, like 64% of all New Year's resolutions are done by the second week in February, if not sooner. Like that's the 64% at least are done.
Because those people are successful and accomplished every goal they set out for?
Right. No, because they're overwhelmed. They beat themselves up. They've got cravings. They haven't fully committed to the full picture, and they have a life outside of their health. And so what I teach is how to create a lifestyle so it's small sustainable changes, so you're layering success on top of success on top of success, so your brain goes, this is uncomfortable, but we didn't die. We actually feel kind of good. Okay, what's next?
Yeah. And I think that if you make the changes with the same level of discomfort, if you keep pushing your envelope with the same level of discomfort, you get where you need to go.
Mm-hmm.
Maybe the first change has a level of discomfort, and don't rest on that. You accomplished that, you've made it happen. Now take the next change. Don't take anything bigger than the first one. But now, like you couldn't have taken those two at once, but you could
Mm-hmm.
take them now one at a time. And then don't rest on your laurels. When you're comfortable with that one, it's time to make the next one. And that actually is possible. You kind of do the same thing, right?
Yeah, it's about baby steps, right? So when I work with a client, we set 3 baby steps that are a stretch, but that they know for a fact that they can do no matter what, right? Because we've got to get our brain on board. Water is a big place to start because most people are chronically dehydrated in America. And so getting them to drink half their body weight in ounces of water per day is kind of a minimum. But some people, like I have one gal, she was drinking 240 ounces of coffee a day and 1 bottle of water every week or two. I mean, she was on coffee 24/7. She was doing laxatives because she didn't have the ability to have a bowel movement without them. And so I talked to her about water and she's like, okay, so if I've got to do that, and for me, really looking at how do we compensate for the other things that we're drinking, right? Like diuretics. Coffee is a diuretic, so it pulls the water out of our body or pushes the water out of our body. So, compensate for every cup of coffee you have with 2 more glasses of water. So if that was the case,
be in the bathroom a lot.
Absolutely, right? So 240 ounces times 2, that's 480. She was about 200 pounds. So that's another, so she's at like 560 ounces of water a day based on just what she was drinking in coffee. Not going to happen.
560 ounces, that's how many gallons?
About 4.
That's a lot.
It is. And never would I tell somebody to drink 4 gallons of water in a day. You flush out all your electrolytes and everything else.
Right.
But the goal is to be able to make small changes. So for her, it was the gallon challenge, right? You don't have to give up your coffee, but start drinking a gallon of water a day. It's 4 of these, right? And when she started drinking more water first thing in the morning, she didn't need the coffee. Shocking. She needed a little bit just to be able to take the edge off the headache because she had caffeine withdrawals. But that lasted about 3 or 4 days. And then she was drinking a gallon of water a day and felt amazing.
And the same thing happens with food. You miss it at first, but you start to find a week later that you feel better. If you're a chronic pain patient and you've been taking pain drugs, you're going to find that they start to work better.
Yeah.
And then you find out, when you were a child and you did something mama told you not to do, didn't you get smacked upside the head at least a little bit? And, some people say, no, my mother never did that. And I look at them and go, well, your body's teaching you what your mother didn't teach you when you were a child. Now, every time you do something your body asked you not to do, your body smacks you upside the head and sends you to your room. Now that's a headache. It's your back pain just got worse. It's you picked up a Kleenex and you thought you threw your back out, but it wasn't the Kleenex. It's the inflammation from a tweak you did in your strings as you picked it up that would have never happened had you not eaten what you ate yesterday.
Yeah.
Yeah. So
totally agree.
Learning how to do that is so, so important. And when we use our injection techniques and we take all the tenderness and all the hardness out of this muscle and make it soft like a baby's muscles, so to speak. If you glue this back together and your pain comes back in 2 days, it's almost always your food. So take that out now before you come and see us and see how much better you are. And then when we do body work on you and do loosen you up, you stay loose for a lot longer. It's a whole lot more fun. All right, we want to open this up for questions. But before we get to that, I want to just take just a minute. We decided at the Blatman Health and Wellness Center just in the last few weeks, we're going to put on a program the first Saturday in February, right before, a week before Valentine's Day, 6 hours talking to people about what food do you need to change? How do you do it? How is your body put together? What is your anatomy really like? And then how to help you make your headaches go away, your neck pain go away, lower back pain, foot pain, and carpal tunnel syndrome. We're going to talk about all of them over the period of 6 hours. There'll be an admission price. Look for information on our website. Look for information online, and we'll be glad to talk about that very, very soon. And right now, let's open this up for questions. If you have a question to ask for me or Jen, please unmute your microphone and speak up, or make it on the chat piece. And I hope this is loud enough, and thank you very much for the suggestions to do that. Are there any questions? Yeah, go ahead.
I've got a question. First of all, thank you very much, both of you. My screen wasn't showing you at first, Dr. Blatman. Could you show which muscle you were talking about?
Yeah, this muscle right here in the front and side of your neck that comes down and attaches on the top of your collarbone that you can grab this way.
Perfect.
Okay?
Thank you.
And this makes this pain pattern that goes across your head and is often part of migraine and also trigeminal neuralgia, so-called pain, and also so-called TMJ pain sometimes.
Sweet.
All right. Well, thanks everybody for attending and listening. Jen, thank you very much. Do you have any
Thanks
last
for having
words
me
to
on.
say? Hello?
Just remember baby steps. Instead of New Year's resolution, set a New Year's intention. What kind of health do you want to have in 2021? What do you want to create? What are the first steps that you can be able to take?
I like
And then
that.
just keep making new changes, going in the same direction. So think about going from here to LA, right? You can be able to go in a straight line, or you can take 1,001, potty stops. As long as you keep going, you'll eventually get there. So set your intention of where you want to go, what you want to create, and keep moving that direction.
Point yourself toward the star of light, aim for that beacon, and have a wonderful day.
Yeah.
I
Hey,
know.
Hal, we've got one question from Katie.
Yeah.
She was asking about foods.
Ah,
So the biggest food contributors were dairy, gluten, and sugar, artificial sweeteners. For some people, eggs. For some people, soy. I've also seen a lot of people with MSG and even some food colorings. So it really depends on the person, but the big ones are soy, gluten, and dairy, and sugar.
and don't forget about fake fat.
Yeah,
Cool Whip, Miracle Whip, Crisco, vegetable oil, margarine,
margarine.
not your friend.
Mm-mm.
All right. Bye, everybody. Have a wonderful day.
Bye, guys.